Dr. Leisle, we know that for adults there are different types of crowns, beautiful ceramic crowns, gold-laid crowns, stainless steel crowns and stuff. Does that also exist for children? And what should parents kind of know about what to choose? Is it just a matter of price, or is it a matter of functionality? Shed some light on it, please.
Sure. Sounds good. Yes, on the front teeth, white crowns can be made. Obviously, if the cavities are too big for doing fillings, white fillings, then the next thing we have to go to crowns, because crowns will preserve the structure of the tooth. In other words, if there's so much decay on the tooth that it can't be preserved, the structure of the tooth cannot be preserved when you bite, then you're going to need something stronger. And so white restorations can be done when there are small fillings, or veneer bondings can be done when they're bigger, but then sometimes we have to go to crowns. Crowns can be stainless steel crowns with a white porcelain front or a plastic front. They can also be stainless steel crowns in front. So obviously the white crowns look much better aesthetically than the stainless steel. Then it becomes a matter of finances, what you're going to be able to afford. In the back teeth, for children, stainless steel crowns are the best to use at this point. On adult teeth, you can have porcelain crowns, gold crowns, non-precious crowns. You can have all different kinds, stainless steel crowns. But in children, because the teeth are going to be in there, the back teeth, posterior teeth, are going to be in there until they're 10 to 12 years of age, stainless steel crowns are the best crowns to use. White crowns have not, there have been some that have been made, but they'll break. And unless you want to be the dentist every 6 months replacing white crowns in the back, it's just not going to happen at this point. Now, in the future, they may come out with something, but stainless steel crowns are the best ones to use. They keep the tooth sound, so when you bite, you're not going to have problems. They're not going to break down. When you have you want a stainless steel crown when you have a very large silver filling in there already, and it's breaking down. So it has to preserve the integrity of the tooth, preserve the bite. Stainless steel crowns are needed.
Okay. So, and, they of course do look steely, silvery, but it's back there in the mouth.
Hence the name.
Hence the name. So they're back in the mouth there, and without really, so to say, taking a deep look into it, one doesn't really see that much, and so it's not that thing. Well, why is it that should adults also take stainless crowns in the back, or is it for them okay to have the ceramic ones?
Well, no, obviously you run gold or porcelain in the back aesthetically. It's not in our society. Stainless steel wouldn't go over real well. Just like you wouldn't have gold front teeth, and some people do. You wouldn't do that because we believe in aesthetics. We believe in a nice smile. We want an attractive smile. When a child, some of the children we have kids come in our office that have 0 cavities when they come in. We used to have kids that come in our office that have 26 out of 20. In other words, you have 20 teeth in your baby teeth, but you have 26 cavities on them. Well, when you see children have massive destruction in their mouth, fillings aren't going to work. You're going to have to go to crowns. And so it's not a point of aesthetics, but it's a point of functionality.
Right.
When you have an adult, obviously aesthetics is going to be there with functionality because you have so many more options. But you're not paying $800 to $1,000 a tooth for a crown. It's a lot less for a stainless steel crown on a child. But right. You want to these are temporary. They're temporary until a child is 9, 11 years of age, 12 years of age.
Right. But at the same token, losing them, pulling them, simply is not an option because, as you mentioned, that makes this second set of teeth, the permanent set of teeth, coming out in a weird way, and you're going to spend all that money and more on orthodontic work. Never mind
yes.
that you sentence the kid for 2, 3, and more years of wearing ugly braces.
That's right. That's exactly right.
All right. Well, all right. So stainless steel, is It's good.
We call them jewels, by the way, Helen. In the office, the kids come in and says, "Yeah, am I going to get in the jewel today?" We call the silver filling stars and the white restorations, and we call the crowns jewels. And the kids, they love them. It's usually the parents, the adults are the ones they have the challenges with. The kids, you approach it with the right attitude, the kids are going to do fine. Right. Or bling bling. Some kids, I get my bling blings.
Right. No, I can see that. I mean, my very, very first girlfriend back in Austria, and we actually were together for a fair amount of time. And she had a gold tooth, and I thought it was cute like hell. Right in front. I thought it was cute. I thought it was cute like hell. And that's right. So, it's really kind of a matter of how you want to look at it, I guess.
Or beautiful as heaven. That's right.
Yeah, good. All right. Thank you very much, Dr. Leisle.